Welcome to the webinar, Leaders' Roles in Facilitating Psychologically Healthy Workplaces. We're glad you're here. My name is Mark White, and I'll be moderating the webinar today. I'm the CEO with the Canadian Institute for the Relief of Pain and Disability, and this webinar is made possible through the support of the Community Grants program from the BC government, as well as donations and membership to our charity. Our presenter today is Dr. Arla. Dr. Arla is a professor in industrial organizational psychology at St. Mary's University in Halifax, specializing in occupational health psychology, and she's the director of the CN Centre for Occupational Health and Safety. She's a fellow of the Canadian Psychological Association, and she was a Canada Research Chair for 10 years. Her research focuses on developing and implementing effective organizational and individual initiatives that address leadership, healthy workplaces, workplace respect and civility, employee well-being, and work-life balance. Thank you once again, Professor Day, for joining us.
Well, thank you, Mark, for inviting me. And thanks everybody for joining us today. I guess it's good morning for anybody out on the West Coast, and good afternoon for anybody else in any east of that. Today we're going to be talking a little bit about how leaders can facilitate psychologically healthy workplaces. And I first wanted to, oh dear, there we go, to give a bit of an overview. So today I'll go over talking about psychologically healthy workplaces, and then talk a little bit about where leadership falls in that, and looking at some of the models that we have of healthy workplaces and leaders' involvement. Then I'd like to go over some of the initiatives that have been done in the past and are going to be taking place in the future about how can leaders intervene, both directly, what can we do to impact on the leader, what can leaders do to help group initiatives in organizations, and how can we help individuals and individual health. And then trying to tie all this together in what does it all mean. And first I would like to acknowledge, so some that I've been working with for the past 20-odd years, some students and faculty both at St. Mary's, at Acadia University, at Western, and elsewhere, Sonia Stevens and Lori Francis, and Nikki Hartley, Kevin Calloway, Krista Randall, Sam Penny, Deborah Gillen-Orrin, Michael Leiter, and Heather Lastinger. And these programs are ones that I'll be talking about today, and how they can help us develop healthy workplaces. So to give a bit of background, Mark did a lovely introduction there, just to kind of who we are collectively, I guess my colleagues and I, and what we do. So if I had to describe sort of the last 20-some years of my career, I'd say it's really looking at employee well-being and effectiveness, and developing that in conjunction with the organizational effectiveness. And in doing so, we've been developing evidence-based work practices that can be integrated into organizations. And some of these are at an individual level, such as ACT and ABLE. Some of them are targeting leaders directly, such as LEAD coaching. Some of them are aimed at the group level, such as CREW. And then we have the overall healthy and respectful workplaces work that we're doing. And a big piece of this puzzle, as you can kind of see, a little bit disjoint from everything, is the idea of organizational change. Because a lot of times that is the piece that gets left out, and that is the difficult thing. So how do we get these organizations to change as a whole, whether it be on some of the individual initiatives, or whether it's creating healthy workplaces overall. So in looking at what healthy workplaces are, we should first start looking at what we describe as health and healthy employees. So anytime that we look at health, and as the World Health Organization has defined, it's not only the absence of the negative symptoms. So we'd like to have lower physical symptoms, lower stress, conflict, negative mental health symptoms, and burnout, but there's also has to be the presence of higher levels of the positive, both physical and psychological health. So physical indicators, satisfaction, efficacy, engagement, the hope, optimism, well-being, energy, respect, efficacy. So in looking at that, we can define psychological healthy workplace in a similar vein is that are ones that try to minimize these negative factors. So we try to minimize the stress in the environment and the conflict, any toxic environment, relationships at work. We try to minimize overload, accidents, et cetera, et cetera. But again, it can't just be the absence of the negative. We also have to have the presence of all the positive factors. So looking at health and safety, we have to have a respectful workplace, and where there's trust, we want to have an engaged workforce. We want to have strong supportive leadership and encourage balance and resilience. And in looking at this, similar to, as I said, sort of my focus being on both the well-being, employee and organizational well-being, anytime we look at this, it has to be that dual focus on improving the individual health at the same time as improving organizational functioning. And we defined this in a paper several years ago as healthy workplaces are workplaces in which the leaders and members, they value each other, they value their work, and the overall organization. They're dedicated to promoting and supporting the physical and psychological health of each other, and importantly, while simultaneously incorporating solid business practices to remain efficient and productive. So in addition to some of these values, the behaviors that we have to see is that people are treating each other with respect, and that they're engaging in activities that foster the health of all workers. And I always find it illustrative if we kind of take a step back and look at how psychologically healthy workplace, the term and the concept, has evolved. So initially, when we were thinking about a healthy workplace, we viewed it primarily in terms of the physical environment. So it was the physical health and safety of that in terms of, do we engage in safe behaviors? Are there any toxic dangers around? Looking at asbestos abatement and those types of proper handling of chemicals. And this was a very important start into a healthy workplace, to have these very basic and important health and safety, physical health and safety. Then, through a lot of movement through organizations and researchers, they said, well, that's great, but health involves more than just the environment that way. What about employee behaviors and lifestyle? And we got a lot into employee health promotion as organizations, and looking at how do we promote healthy lifestyles. That can be having smoking cessation programs. It can have healthy eating programs, healthy weight programs, cholesterol screening. So if we want a healthy work environment, how do we encourage these healthy lifestyles? And that was very, very effective there. But we said, well, wait a second, there has to be more than that. And kind of separately, there was a whole realm of literature that was dealing with the psychosocial environment at work. So leading employees, motivating employees, and looking at job control and what impacts employees. And we realized that we can look at a healthy work incorporating all of these. So it is the leadership and recognition. It's having a healthy culture. It's that respect. It's work-life balance. It's treating people fairly. And conflict resolution, of course. So what we did in 2005, Kevin Kellaway and I came up with a model trying to integrate what people had written about healthy workplaces and talking about the psychologically healthy workplace. And this model has evolved somewhat over time, but some of the basics that you see here is what came out in 2005. And at the same time, APA, American Psychological Association, had come out with some similar ideas, and Grawitch et al. had come up with some ideas about, yes, it's the physical and psychological health and safety of employees. How do we promote employees' growth and development? How do we recognize them? How do we provide that supportive and respectful culture, ensure that there's good work-life balance, and involve employees in decision-making and the environment and the workplace? And again, still focusing on that dual of employee and organizational function. What had evolved over the years is a little bit of this aspect of respect. And it was always integral kind of as the culture part or interactions with leaders and subordinates, but really as it came out that it became a sort of a central aspect of healthy workplace. So that if there was this mutual respect among employees and leaders and all organizational members, then of course we'd want to do what's in their best interest, that we want to treat them, recognize their accomplishments, involve them, listen to them, and want their growth and development. Now, for many of you, you may also be familiar with the National Standard of Canada for Psychological Health and Safety in the Workplace, and they came up with 13 criteria. I know a lot of organizations find these daunting, but if you look at them, they map onto the similar stuff that we were doing 10 years before that, and really looking at how do we disentangle some of these things? How do we provide the support and the culture for the organization to support employees? So when we look at this, and we can see that leadership factor is integral to many of these aspects. And what do we know, then taking step about leadership and well-being? Again, leadership and culture are integral to a lot of the psychologically healthy workplace models that we see. And it may seem basic, but research shows good leadership leads to positive employee outcomes, and poor leadership is associated with negative employee outcomes. So there's a fairly good literature describing all of those relationships. The question is how we link all of these. So, and Matt Rowich had argued that leaders may not know how to foster a psychologically healthy workplace. And other research have shown or have taught in their qualitative work saying that, yeah, we know that we should be doing that, but we don't know the steps involved. So it comes down to the crunch of how do we get started? How can leaders create these healthy workplaces? And in any time we're thinking about changing a workplace or doing interventions, a very good place to start, I would say, is Sauter and al. In 1990 article, and they were talking more about stress and workplace health that way, but it applies to all healthy workplace interventions. And if we view it this way, we can look at primary, tertiary, and secondary and tertiary interventions here. So at the primary level, we're changing the workplace. These are looking at either increasing resources or decreasing demands for employees, changing the job, somehow modifying the workplace to make it healthier, a better place to work for employees. We can also look at secondary interventions, and that would be targeting individuals more so. So changing their perception of what their work-life reality is, providing resources in terms of resilience. So when they have deadlines or when there are demands that can't be avoided in the workplace, what is the individual able to accept those challenges and move forward? Then the final one is the tertiary, and these are treating the symptoms, so that when we do have health issues, whether be it physical health issues or psychological health issues, how are we best predisposed to treat them? And it could be through accommodation, it could be through EAPs. What does the organization have in place to help address strain and stress in the workplace? So when we're looking at those, again, we come to the primary question of who is then responsible for healthy workplaces. And when we talk about this, we look at the whole view of the organization. So within the organization, we have leaders embedded in the organization, we have groups embedded in the organization, and then we have the individual. And then, of course, if you have unionized environments, the union is integral at all of these levels in supporting the and ensuring good group processes, effective leadership, and a healthy organization. Now, I bet because you know the topic of today's webinar, you know then the focus we'll be looking at is the leaders aspect of it. But when we start thinking about leaders, really the organization is made up of organizational members, leaders, and direct reports, and the leaders influence their groups. The leaders can support the individual. So when we're talking about this, it really does come down to the important role of leaders. I have been playing around with models, as you can see from this very busy and interesting model here. And I was in New Zealand over the winter and talking about leadership and healthy workplaces, and I've been playing around with a little bit more of this model. And several of my PhD students have been doing their own models, which we'll be talking about in a bit, and thinking about what are the mechanisms by which leaders can influence employees directly, but also indirectly through the healthy workplace. So if we kind of scale this back a bit and just look at leaders and employees within that context of a psychologically healthy workplace. Now you notice that for the employees, I have both talking about their health and competence, because again, we're going back to that healthy workplace. It has to be made up of not only physical and psychologically healthy employees, but it has to be made up of the competent individuals who are able to do their job so that the organization is effective. So anytime we're talking about this, we're always thinking about those things simultaneously. Now, most of the research out there, when we're talking about how leaders can create healthy workplaces, it really is about this direct interaction. So we think about how leaders and subordinates interact, about the extent to which they can be transformational leaders, they can provide individual consideration, the extent to which they have respect, mutual respect and trust, how it's the communication is both ways, and the extent to which they support employees. But when we look at leaders, there's also other mechanisms. So we can think about the way that they influence, formally or informally, the culture, organizational culture, and the environment. And we talk about being able to increase resources for their employees or decrease their demands. We can also look at it in terms of more formal aspects in terms of the HR functions. So how leaders, again, can directly and indirectly affect selection, training, job redesign, and programs. The selection is an interesting one because when we think about healthy workplaces, we rarely think about the recruitment and selection aspect of it. But if you have the right person in the right job, that is going to create, again, increased competence, but it's also going to create less stress and strain for the individual. So the very first place when we're talking about this is how we are selecting, how we're recruiting and selecting employees, and how we're also selecting leaders as well, but training them. So are these individuals getting the right training to do their job? And not only in that competence piece, but also in terms, are they getting the right training in terms, or the training that they need to handle crises, to handle individual, both work and outside of work. Leaders can influence the HR functions in terms of job redesign, which is, it can be in terms of how do we make the jobs better, how do we make people more effective at their jobs by changing the job and job requirements. There may be special instances of accommodation. So how do we accommodate employees based on physical and psychological disabilities so that they can do the job to the best of their ability. And then, of course, if we're talking about psychologically healthy workplace, what types of initiatives are out there that leaders can help implement through the organization. Now, in looking at this model, though, we also have to look at what comes at the leaders themselves. So just as we talked about employee competence, it's also essential to look at leader competence. So selecting the right leaders, training the leaders, whether it's in general leadership behaviors, transformational leadership, or whether it's more specifically how to lead healthy workplaces, which we'll talk about in a bit. We also have self-care listed here. Now, this came out of some of the research that we've been doing on, again, on employee well-being, and talking to leaders and saying, we know how to take care of our employees, but who's taking care of us? And the analogy we always look at is whether in terms of, in any caregiver role, you can't take care of other individuals, you can't be an effective leader if you are not taking care of yourself. I also give the example to people if they're thinking about this, is think about your own leadership behaviors and when you're a good leader and when you're a bad leader. And if somebody comes and asks you, for the 5th time for the same documents you gave to them and doing all of that, you're more likely to respond in maybe a fair and respectful manner if you've had the 8 hours of sleep, if you aren't running yourself ragged, and if you're feeling okay. We all know at the end of the day, during a deadline, if we're feeling rushed, if we haven't slept, if we forgot to eat, when we're in those types of situations, those are the ones where we're more likely to crack. So self-care is essential to a healthy workplace for leaders as well as employees. There's also that self-awareness that we talk. In order to be an effective leader, I think that we define that as, in terms of the competence, is being aware of yourself, how you impact others, how your behaviors impact others, and being able to modify those behaviors on a one-to-one basis and as needed. So what we've been looking at then, again, are these mechanisms. So we may have a good idea about the direct impact in terms of on employee health, but less so in terms of a healthy workplace, and less so in terms of role modeling. How can leaders role model? We heard from focus groups and stuff, this seems to be a key aspect in terms of a healthy workplace, that they have to not only role model the respect, the communication, trust, and support, but also what it means to have a healthy workplace, and whether that is work-life balance, whether it is that self-care piece of it, whether it is being involved themselves and looking at their own growth and development, all about how do they walk the talk there. We also talked about lobbying, education, and promoting. So lobbying for the welfare of their employees, lobbying programs and policies that would help create healthy workplaces, educating the workforce on what does it mean for a healthy workplace. Where does respect fit in? How do we engage in respectful communication? And also actively promoting those. So in looking at those, and then the final bit is, even though we're not focusing today on the whole piece, is I have this feedback loop from employees to leaders. And this is in terms of communication, support, respect, and trust. So if we're looking at a psychologically healthy workplace, it is a two-way or multi-rate here where everybody has to interact with the same level of respect and trust. So if we're going back to our model of interventions in primary, secondary, and tertiary, we can see that leaders fit in nicely in all of these categories in terms of they're able to change the workplace, formally, informally, increasing resources, decreasing demand. Also, though, when we're talking about changing the workplace, we can be talking about changing leaders. So how do we change the leaders in terms of providing the necessary training for them, developing their skills and abilities, and providing them the resources to take care of themselves and gain greater insight. Leaders have a good role in creating that resilience in their subordinates, having that respectful culture, supportive culture, so that if things go wrong, the employees are better able to handle them. And then, of course, the leaders are able to supply or have input into the tertiary in terms of how do we treat the symptoms, what kind of programs do we have in place to adequately ensure that our employees are healthy, and how do we go about accommodating. The leaders and frontline managers are the key individuals, and how do we help individuals do their job. So in using this model, how can we then turn this into effective programs and initiatives? And what can we do? What I've done for today is I've compiled some of the work that we have been doing, so collectively myself and my colleagues, in that can move the whole agenda of psychologically healthy workplaces forward. Now, these aren't all targeting leaders, but leadership, I would argue leadership is integrated in all of these in some important way. Now, the first way is the clearer way, it's the direct leader-focused initiatives. And there's several programs here. So we have the LEAD, the Psychologically Healthy Workplace through Leadership, and the RIGHT program, and then the mental health awareness training. So looking at the LEAD is the leadership effectiveness through accountability and development. Nicola Hartling is the lead on this, and it's based on the premises that a transformational leadership is associated with healthy employee outcomes, and that these leadership behaviors can be trained. And the LEAD is a phone and web-based coaching program where individuals have 10 weeks of individual sessions with trained coaches, and they get web-based information, and they work through a manual and through activities, and they're encouraged on a daily basis to put the behaviors that they're learning about into practice, so that there's a lot of goal setting in that. And we have some preliminary results from this in looking at that, yes, as we said, in subordinate ratings of leaders, transformational leadership, is associated with their own burnout. So it's associated with less emotional exhaustion and cynicism, but also this transformational leadership is associated with greater professional efficacy. We also know through some of the preliminary is that the LEAD program is important at increasing self-efficacy. So the intervention group compared to the control group was able to increase their efficacy, their leadership self-efficacy over the program. And we know efficacy is integral to how they're interacting with their employees and also integral to their overall well-being. And we know if we have higher leader well-being, that's associated with higher employee well-being. The mental health awareness training was developed by Jen Demoff and Kevin Calway, both at St. Mary's, and they were looking at a program to increase leaders' awareness of mental health issues at work. So how do we just get out there and increase that awareness? And again, an integral aspect of healthy workplaces is being aware of everybody's mental health, whatever levels we're at. So their workshop, they've demonstrated that after training, their leaders have demonstrated increased knowledge of mental issues in the workplace, more positive attitudes towards individual health concerns. And this is important because it really can lead to that destigmatization within the workplace of mental health concerns that can be prevalent in group settings and on an individual basis. So leaders are one of the key drivers of more positive attitudes within the organization. Leaders came out with more confidence to deal with mental health concerns in the workplace, and also with an increased intention to actually go out and promote this mental health. Samantha Penny has been creating looking at fostering psychologically healthy workplaces through the leaders. And she's been starting by looking at interviewing and conducting focus groups with leaders and subject matter experts and looking at how do leaders impact the healthy workplace. And as I'd mentioned before, so a lot of what her information coming out from this is that it's those direct communication. It's the direct support of employees. It is effective communication, providing constructive feedback, and involving and developing those employees. There was also a whole category of how they went forward promoting a psychologically healthy workplace. And some of this was through the mechanisms we've discussed before about modeling the behaviors. It was also through championing initiatives and creating those initiatives for the workplace. So she's moving forward with this and looking at then how can we train leaders on these key aspects so that they have the knowledge and the skills and the behaviors to go out and facilitate healthy workplaces. Similarly, Sam's also been involved with the RIGHT leadership with Kevin Kellaway and Jen Demoff. And the RIGHT is an acronym for Recognition, Involvement, Growth, Health and Safety, and Teamwork, which you may recognize is a direct extension from our 2005 Healthy Workplace model and 2014 model. So the recognition point of it we have in terms of the involvement, the growth and development, the health and safety aspects, as well as the teamwork, which sort of encapsulated the culture and the leadership aspects we previously talked about. And work-life balance was then put in under physical and psychological health and well-being there. So they have a sort of theoretical model of that and then are going ahead and testing that. So those are just a few of the direct ways that we look at leaders and that we can impact on leaders and leaders can impact on employees. Leaders, the group initiatives are incredibly important. Those social influences at work, how we treat each other, are key. And leaders, of course, have huge influence on the behaviors of groups. And one of the key initiatives we've been doing with that is the crew, and an extension of that we're working on now, which is work, which I'll talk about both of those. And as you can tell, we all love acronyms. So any of our programs have acronyms to go along with it. So the crew is a civility, respect, and engagement at work. And it was introduced first with Veterans Affairs by Osatek et al. In the US. And from there, we hooked up with them and did some work in Ontario and Nova Scotia in hospital settings and looking at, is this something that we can increase respect and increase a civility and engagement in the workplace? Now the process is different in that this is, instead of an individual program, it is really focused on the unit. So how does the unit members, how do they interact with each other? How is a leader involved? And really looking at effective facilitation of these groups. Now the role of the leader on here is multifold here. We have they can role model the behaviors that are outlined by the collective group in terms of what the standards are. They can help support the unit members' behavior change, and it also involves changing their own behavior in some cases there. So the crew, and this has been written up in several publications, quick summary of it is looking at that it has been effective in increasing respect, civility, decreasing incivility, not only of respondents, but also their reports of their coworkers' level of incivility, as well as the leaders' level of incivility. It also has been shown to be effective to reduce absenteeisms and increase trust among group members. And in just looking at a couple of graphs here, just to illustrate, so we did again, a couple of different studies in looking at this, but looking at supervisor incivility in the two groups. So the red line is indicating this was the intervention crew group, and then the black dotted line was the control group. And as you can see, they were chosen, the groups were chosen because they had significantly high incivility and some issues to begin with. But what we're able to show is that over the course of the program, we've got a significant reduction. So between time 2. We see significant reduction where there was no change in the control group. What we also were pleased to see is that this continued at a 1-year follow-up, so that we were able to put in the group processes, implement group processes that would sustain over time. So a lot of times when we have interventions, as soon as the interventions stop, the behaviors revert back to baseline. Another interesting work from here of how supervisors are involved, and this is another data set looking at frontline managers, and this whole idea of my own incivility, how it is impacted by my supervisor's incivility. So as we can see in general, if you look at this, supervisor incivility is related to your own level of incivility. So if they're behaving rudely, you tend to behave rudely as well. But what we also look at is sort of that key element of trust in this picture, is that we see, so at high incivility, it doesn't matter how much you trust. If there's high levels of incivility, you're probably going to have high levels of your own incivility. But when it comes down to trust, if you have low supervisor incivility, you also have to have that trust with there. So having that trust in management will then is associated with lower your own instigated incivility there. So again, how leaders can influence directly and indirectly the roles on that. The other area of research that we have, sorry, here we go, is looking at, when we're looking at incivility, why are we behaving rudely? And part of our research showed that there was 3 or 4 areas or rationales of why we behave rudely. And one of them is looking, most common one, are people saying, I was just so pressured, I was under a lot of pressure, I was frustrated, and I was so stressed out that I just couldn't help myself. So I ended up yelling or being abrupt with somebody. And I didn't mean it, but I was under that pressure. I think this, we see leaders under a lot of stress where they have this rationale and they excuse it on a constant basis. So looking at how can we ensure that A, we maybe reduce the pressures and frustrations, and B, that perhaps that we increase resources to individuals to better handle any of those frustrations and stressors. The other, I've got a lovely picture of House here, if anybody was a House fan when it was on TV, was the toughness rationale. And this is directly related to leadership of that really, you may view it as rude, but that's what I need to do in order to create an efficient workplace. So you have to be tough with these people. You have to be on their back. You have to make sure, or you're not going to get the type of efficient workplace and efficient type of productivity that you need. And again, if we can go in and do training and demonstrate how other behaviors are more effective. So this tough love kind of leadership is very effective, can be very, very effective in a short term. If I've got somebody with a stick over my back, I am probably going to work a little harder, stay a little later, get it all done. I may not be as attentive and I may make more mistakes. I also may be thinking of how can I get out of the situation. So when I go home, I'm going to have my resume ready to apply for other jobs, or I'm going to burn out. And it doesn't matter how much you have people that stick over me, I'm not going to work effectively. The last 2 rationales, looking at that it's not my behavior, it's just the situation or the other individual. So the sensitivity rationale, if you're an Office fan, then you can relate to Jim in there, who dislikes his coworker Dwight, and his rationale is I'm not being rude. Dwight is just way too sensitive and he needs to get over himself. So with the sensitivity rationale, there's a lot of ways that we can direct behavior. Again, for leaders have to be in a role to say, okay, what is appropriate and inappropriate behavior, help define that, but also look at their own behavior there. And the thing with the sensitivity is there isn't always a right and wrong answer for this. There's extreme wrong behavior that we all can identify, but some of the incivility in terms of can can be very subtle, and it's not intentional, and the individual is not meaning to be rude or to hurt, and if somebody is very sensitive to those cues, it may result in conflict. So just being aware of those issues. And finally, one is the reciprocity of the norm. So that I was just reciprocating the behavior because the person did it to me first. We also know that as the grade 5 rationale in behaving, but it's also the norm. This is the way we treat each other. It's not rude, it's just the way we behave. And again, the leader has to take a stance on this in terms of what are acceptable behaviors in the workplace. How do we stop this sort of spiral of misbehavior, and how do we come to an agreement in terms of how we want to work here? And then finally looking at the work is sort of where we are progressing in the future, and that's the worker and organizational responsibility training, which is based on crew. It's based on some of our other work on rudeness rationales, and based on some of the aspects of Deborah Gillenore's conflict training. And I'm just going to sort of go by that one quickly, and if people have questions, we can talk about that later. Then finally, how do we look at the individual initiatives? So a lot of the individual initiatives that we're talking about, again, are looking at how do we develop individuals in terms of developing their resilience, of being able to balance work and life better, and also deal with job and life stressors. So ABLE is the Achieving Balance in Life and Employment program. And again, this is what LEAD was based on in terms of the format. It is a 10 or 12-week phone-based coaching program, and where you have trained coaches. It's tailored to the individual based on their individual needs and goal setting. They have the manual and web resources. And the focus on leaders here is that we have a lot of leaders coming through, and how do we develop their self-care, their better work-life balance, and so that they're better able to identify demands and their resources that they can use to reduce those demands. It's also integral for leaders to provide these resources for employees. So how do we go about and leaders go about and ensure that their employees have the skills necessary to move forward and deal with the everyday demands and some of the crisis demands that we all experience at work and that we can't totally eliminate. Through several, and again, big summary here, for several programs of research that we've had with ABLE, and generally what we're seeing is that we can increase these pro-recovery behaviors. So these are what employees do to take care of themselves after work and to gain energy back, to come back to work the next day. It also is associated with decreased stress and depression and increased healthy behaviors. So just quickly, what we looked at there, I'll just give you an example of that. This was a depression, anxiety, and negative mood, work-life conflict. We saw the same pattern, is that the intervention group received the treatment from time 1 to time 2, and then they saw significant reductions in these negative outcomes, whereas control received nothing, and there was no changes in their levels of depression or anxiety or stress. Then at time 2, the control group became the intervention group, and then they received the ABLE training. And as we can see, after they received the training, their levels of depression, anxiety, stress, mood, and conflict also decreased. And what we're happy with the control group, so who had originally received the ABLE program, they became the control, and they maintained. So they didn't increase in any of these negative outcomes. We also see a similar one. It's for the reverse pattern for healthy behaviors, but the exact pattern that we were hoping there. So concluding, I guess, let's flip back there a little bit, leaders and organizational initiatives. What I wanted to do here, I guess, is sort of demonstrate a few of my favorite in organizational initiatives that I've seen across the country. And one of them is through Scotiabank Customer Contact Center. And we all know customer contact call centers do not have the greatest reputation of being a healthy workplace. We actually gave them an award in 2007, I believe, in our Psychologically Healthy Workplace Awards through the American Psychological Association, because they just exhibited phenomenal initiatives, happy, engaged employees, and low turnover and high engagement. So they do a lot of neat things, starting with a very simple premise of their mission statement is that happy, engaged employees equals business success. They offer flexible benefits for their employees. Their location for a call center, in our review of the place, we had reviewers going through it, and they were saying it was beautiful, it was calm, it was relaxing. They have quiet space, they have support and counseling. So if you get that bad call from an irate customer, then you have some place to go to deal with it and the support. They have employee recognition with their applause program, and the employee of the month. David was their CEO at the time, and it's Lunch with Dave. So I always thought Dave must be incredibly entertaining, and people always said that that's what they wanted. That was a very rewarding to them. And then they surveyed. They asked people, what is it that you want? What are we doing well? What do we need to do better? Another example of a great healthy workplace program, and this was for work-life balance, and this was in BC, and it's the Brookhaven Care Center. And they were having a lot of challenges in terms of child commitments of their employees during the summer. Employees wanted to take more time off in the summer. They were short-staffed, and they didn't know how to balance all of this. And they came up with this little Brooks Club. So this is where the employees brought their children to work and volunteer with their elderly residents. And this is really what I call a great example of thinking outside the box, and this is the win-win-win, probably a win-win-win-win situation. The children were happy because they got all this attention from the residents. The residents were thrilled because they got to interact with kids all day. The parents were so happy because they didn't have to worry about daycare, and the organization was thrilled because they didn't have to worry about being short-staffed. One small solution, and it had this huge impact. So kudos to them. And then in terms of the research on healthy workplaces, Krista Randall and I have several studies that are looked at what are the impact of healthy workplaces. And this is just one of them, and looking at, so individuals who report their place as a psychologically healthy workplace to work, they're also reporting they have lower strain, lower absenteeism, they are less likely to leave, and they're more engaged and committed to the organization. So all good things. So in conclusion then, what does this all mean? We know that leaders can impact on employee health, directly and indirectly. We know that leaders can lead psychologically healthy workplaces. We have identified the components of healthy workplaces, and we know that those components can lead to healthy individual outcomes as well as effective organizational outcomes. We know that we have effective leader, group, individual, and organization programs out there. And not only the ones that I mentioned, but there's lots others out there. We know that leaders are integral to developing respect and civility. So what we want to know then in looking at a healthy workplace, what we don't know is, can we improve leaders' health? What is this multi-focus to workplace health? Is it the most effective? Can we even do it? How do we integrate all these components? And if we go back to that model then, looking at, again, the direct in terms of leaders impacting on employees, how can we tie that in to how leaders can impact the culture and the groups and the work environment? How can we tie that into how leaders are interacting with HR and lobbying for their employees and creating these healthy initiatives? How do we look at the mechanisms that by which they meet the mediators or other important moderators in this relationship? And then finally, how do we look at the leaders themselves and increase their own well-being? And when we're looking at this, I just wanted to leave you thinking about this last one. Does it really all come down to a little bit of Aretha Franklin here? Does it all come down to respect? Several years ago, I did some blogs from the American Psychological Association about, maybe Aretha had it right. All we need is respect. And I think when we're thinking about healthy workplaces, that is integral to it. And Christine Horath did a study with Harvard Business Review of 20,000 employees across the world. And she found that being treated with respect was more important to employees than recognition and appreciation, communication, inspiring vision, any of these things that we associate with the leadership role. But despite that, leaders know that they must demonstrate and show respect is so integral, many struggle to demonstrate it. So how do we help the leaders look that way? So thank you very much. And if you enjoyed this, I know we have time for questions now, but I was going to put in a plug for, we have our 2017 Occupational Health Psychology Summer Institute in Halifax next July. So please feel free to contact me for information on that, where we talk about healthy workplaces, and we have the Healthy Workplace Awards, and we also talk about leadership, etc. So thank you very much.
Well, that was just wonderful, Dr. Day. It was, you know, such a great overview, and then drilling down to some more concrete examples and components. I found it really stimulating. We do have some questions, and I would like to invite others to enter any questions that they have into the question area. And I'll start off with the first question. In some industries, staff is very diverse: culture, immigration status, work permits, limited language abilities, and low pay. Are there some exercises that can be done in a team environment to, now she said, to send out a message, change thinking, or to get people thinking about, I would imagine, psychologically healthy workplaces? And
yeah, definitely. And I think not only in a team, the team environment is great for these types of initiatives, because we are greatly influenced by this by the social relationships with others. So what we're doing, in terms of diversity, I think it comes down, again, I am going to bring it back to sort of that respect aspect, and I always start with the organization, and I would hope organizations have the mission statement about respect and about treating people despite their differences with respect. And not only that, but I also talk about leveraging those differences and leveraging and building on. What is it that people bring to those teams? And there's several exercises that you can do that look at individual strengths and in a team environment. And I think there's some research coming out of Concordia or Laval, I'm blanking on the moment, looking at some of those initiatives, how we build the team diversity and look at leveraging strengths that way. There's also things that we can do, again, in terms of something like CREW is great, because it talks about what are the standards of behavior in this work group. So despite differences in languages, despite differences in maybe what is culturally acceptable to us individually, what is acceptable in different industries, we can come together as a group and say, okay, but for our group in our workplace, these are the values that we find important, and these are these are our standards of behavior, and then we all keep each other in check. It's us that are maintaining those standards.
In the diagram of primary, secondary, tertiary prevention, this person saying symptoms was the biggest part of the triangle. Does that mean it has the biggest impact?
That's a great question, and no, it doesn't. It was no, it doesn't, and that's a very good point, and I should maybe invert this. I think it was mainly looking at the top is where we want to work. Traditionally, I guess if we look at the Canadian healthcare system and organizations, we've always fallen on treating symptoms first. That's where historically we've kind of said. And then we're starting to say, wait a second, can we actually, before they become symptoms, can we change the workplace sufficiently so we don't have symptoms? Can we help those individuals develop their resources so they don't have the symptoms? The thing is, there's always going to be a need for tertiary. We can't get rid of all demands. We can't get rid of all stressors or anything unpleasant at work. And remember, some of these individuals that are treating the symptoms, it might not be work-related at all. You know, it might be marital breakup, it might be financial stress. But as a workplace, it still impacts on us. So no, it's not. It's not necessarily, it shouldn't be, maybe historically, yes it is, but I would argue it gets inverted. And I might actually do that on my next one. I might say that really focus on the primary, secondary, but realize that tertiary is still important. Good question. Thanks.
Great. And then is there any other questions? Yeah, so another question is, why is the crew model used in hospital settings a unit rather than individual processes? And there's a comment on, was that the New South Wales, Australia? Not sure what that part is referring to.
I'm wondering if it might be actually, I'm not sure if it's being implemented now. Michael Leiter is now in Australia, and I know he is doing some work with crew there, so maybe that's what that reference was to.
Okay.
If they can clarify, if they can clarify, I can try and clarify that. The why is this used instead of individual? So that's a great question, and the idea was that it was instead of targeting individuals and getting away from blaming. So your behavior is inappropriate and you need to change. It was a much more positive way of saying, listen, this is the standards of acceptable behavior that we're all agreeing to, and this is the way we're moving forward. And by doing that, we hold each other accountable, but it's less saying that you are the problem rather than we are taking responsibility for it. Now, in saying that, when we're moving forward with this, and I think if you can see my slides here, with the worker and organizational, the respect and civility training, it is based on that premise that the group is able to set their guidelines and identify acceptable behaviors with that. And of course, when I talk about this, I'm also talking about the group behaviors have to be in line with the organizational values. If you have a group with values that are quite different than the organization, that is going to go astray as well. So we're assuming that they're all in line with their values and the basic values of respect and support and trust. But what we've added, as you can see in here for this, is that emphasis on the individual as well. So we're saying we're learning in a group environment, but also we have individual skills, and that recognizing that maybe some individuals need to practice some things and other individuals need to practice other things. So getting individuals to be accountable for their own behavior as well as that group behavior.